dry skin, tingling sensation in your hands and feet. With men, it might cause erectile dysfunction. With women, it will cause vaginal dryness.
Circle that floats around me, keeping me safe and sound.
Alright everyone, welcome back to my channel. If you are new, my name is Andy. I am a family nurse practitioner. I am so glad that you clicked on this video today, and I have a very important topic for you guys today. I hope you love it. We are going to be talking about type 2 diabetes. So type 2 diabetes is also known as a non-insulin dependent diabetes. It is a progressive metabolic disorder that affects the way your body uses glucose. So glucose is a very, very important source of energy in every human being, and it's a very important source of energy for the cells and the organs of the body. So with type 2 diabetes, your body is making there's too much sugar in the blood, which causes other serious health issues. The body is not able to use the insulin the right way, or it's resisting the insulin that is produced. When you eat food in your mouth, right, the food is broken down in the body, okay? When they're broken down by the stomach, by your digestive system, it is broken down into glucose. Glucose, like I mentioned before, is the main source of energy for the cells and the organs of the body. But for the glucose to be useful to you, it needs insulin. Insulin acts like a key to open the door to let glucose enter into your cells. Then when glucose is entered into your cells, it is then converted into energy. So what is the problem? What happens with type 2 diabetes? So there's an organ in our body known as the pancreas. In this pancreas, we have our beta cells. Beta cells are the ones that produce insulin. And I talked about this more in our type 1 diabetes when I did type 1 diabetes. So the pancreas, when you eat, the pancreas releases just the right amount of insulin that your body needs, okay? But what happens in type 2 diabetes is that the pancreas does not release the right amount of insulin, or when it is released, your body resists this insulin, which can then cause the liver to make too much glucagon. While this is going on, when too much extra sugar is made, the kidney will now allow the extra sugar to pass into your urine. So when that happens, that's when people are found to have sugar in their urine. So with sometimes type 2 diabetes is even found out by a pee. When someone pees and maybe they were complaining of, oh, I'm peeing too much, and they did urinalysis and they found that there's too much sugar in your urine. That means that there's too much sugar in your blood that the body is not able to use, which the kidney has allowed to pass through your kidneys into your urine. Now, our skeletal muscle also has something to do with this, because your body there's too much blood, there's too much sugar in the blood. The skeletal muscle is not able to absorb that sugar or use that glucose for energy, because guess what? We need glucose. Glucose needs insulin to convert it to energy. So when that is not happening, the glucose that your skeletal muscle needs to use as energy is not there. This further increases extra sugar in your blood, because the skeletal muscle is not able to use that glucose for energy. So that glucose will stay inside your blood and increase, which causes more increased sugar and increased insulin resistance in the body. Now, let's talk about your fatty cells. So the fat cells, you know how sometimes with people that do keto, okay, they eat a lot of fat, and that fat is what is broken down and is used as energy for the body. That's why in type 1 diabetes, that happens a lot, and it causes ketone, which leads to diabetic ketoacidosis. So because we do not have enough insulin in the body, the fat cell, that low insulin now will cause the fat cells, like I said before, to break down. And when that breakdown occurs, it makes the liver again to make even more sugar. Oh, so the liver is now making more sugar that the body still cannot use, which further destroys the beta cells, we need to make insulin in the pancreas, okay, which produces insulin in the pancreas. So what are the symptoms of type 2 diabetes? Symptoms of type 2 diabetes include increased thirst. So people with type 2 diabetes will often complain of too much thirst. I'm always thirsty. Oh, I'm always thirsty. I have to drink too much water. Frequency in urination. So urinary frequency, they're peeing a lot. They can pee up to 10, 12, 15 times a day. They're peeing a lot, peeing a lot. Increase in weight. So that's another problem. When someone gains a lot of weight, that's one thing that you have to check too. Dry skin, tingling sensation in your hands and feet. With men, it might cause erectile dysfunction. With women, it will cause vaginal dryness. All right. Risk factors include obesity, lack of exercise. So if you're not exercising a lot, or you're not exercising at all, if you're obese, okay, you have a lot of weight in you, it can lead to diabetes. Family history, we've talked about several times. We've talked about that. Family history of diabetes, there's always a link that another person, there's always a possibility that another person in that family may also have type 2 diabetes. History of pre-diabetes. So if you were maybe screened for diabetes in the past and you were at that level where it's called pre-diabetes, that means you haven't crossed into the level of being diagnosed, into that number where you're officially diagnosed of diabetes. If you have that history, if you're not careful in the past, if things are not put together in place, you might officially cross into diabetes. Being black or African American, Latinos, it's very common in those people. Having high level of cholesterol might also lead you to have type 2 diabetes. How do we manage type 2 diabetes? I'm going to give you 5 keys that are important in the management of type 2 diabetes. Key number 1, you want to know your target blood sugar. You want to know your target blood pressure, and you have to know your target cholesterol. So those things, you have to keep them down. You have to know what is the good number for you. So you and your doctor will sit down together and come up with the number that is good. So for people with type 2 diabetes, it's always best to keep your what is called A1C. So hemoglobin A1C looks at your blood sugar level in a span of 3 months in your blood. For people with type 2 diabetes, we want the A1C to be less than 7. So that's something also that you have to keep in mind, to make sure that your A1C is less than 7. Another number 2 key point is living a healthy lifestyle. So exercising. If you're overweight, if you're obese, it is recommended that you lose weight. There's especially people that are having erectile dysfunction. Very, very important that you keep your blood sugar under control and that you lose weight, because if you don't, then you will have those problems. But if you do, you will see a very, very big improvements in those issues. So like erectile dysfunction, if you lose weight and you exercise and you keep your blood sugar under control, you might not have that problem anymore. Key point number 3, you have to stop smoking. So if you're someone that is currently smoking, it is important that you quit smoking, because what happens with smoking is that when you smoke, smoking constricts your blood vessels, which does not allow your blood to flow freely in your body, lead to tingling sensation, neuropathy, vascular issues, which we're going to talk about in complications. Key point number 4 is making sure that you take your medication as prescribed by your primary care provider. There are several ways in which diabetes type 2 is treated, and that includes both oral medication, insulin injections, and diet and exercise. So those are the 3 main ways diabetes is treated. Okay, so make sure that you take your medication as prescribed. My last key point, which is key point number 5, is making sure that you keep your follow-up appointments. I cannot emphasize on this I don't know how to emphasize on this much more. This is very important. You have to keep your appointments, take your medication as ordered. I can't tell you how many times people with diabetes miss the appointment. They don't come to appointment 6-7 months, I mean 6 up to a year sometimes. And then when they come, you discover that their A1C, their blood sugar is out of control. Okay, so very important that you keep your appointments. Complications of diabetes. So complications include eye disease. So what happens is when you have too much blood sugar in your blood, it causes the vessels in your eyes to be damaged, which can lead to blindness. It can lead to glaucoma, all of that. So you want to make sure that you're getting eye screened once a year if you're diabetic. Okay, you have to get your eye checked every year. Increased blood sugar can increase your chance of having a heart attack or stroke. So it's very important again that you keep your blood sugar under control. Another complication is kidney disease. So what happens is there's something in your kidney called the glomeruli. The glomeruli is the filtering system in your kidney. When you have too much of high blood sugar in your blood, in your body, it can cause the glomeruli to be destroyed, which can lead to chronic kidney disease, which can eventually lead that person to being on dialysis. Getting your blood sugar under control plays a very important role in keeping your kidneys healthy. Another one is vascular disease. So smoking can lead to vascular disease. Like I said before, it constricts your blood vessels. It can lead, too much blood sugar can also lead to wounds in your body not being healed properly. That's why it is very important that if you check your feet as a diabetic every night before you go to sleep, make sure you look in between your toes, make sure you look on your feet, because if you have vascular disease with diabetes or something, the last point of complication is linked together with vascular issues is neuropathy. They cause tingling sensation and numbness in your hands and your feet. When that happens, when the nerve system in your nerves in your body is damaged, you might step on a hot stone, you might step on a knife, a very sharp knife, and not feel it, because your nerves that are supposed to feel those things, that's supposed to make you feel that sensation of being cut, is damaged. That's why it is very important that if someone has diabetes, at the end of the day, they sit down, they look at their feet and their toes, look in between each toe, making sure that you don't have any wounds. That's why food exams is also important. When you have a visit with your doctor, make sure that your doctor is doing a food exam. There's a test we do called Monofilament Test. It's basically a little prickling thing that is used to prick your feet. And if your sensations are still intact, you're going to feel that. If it's not, you're not going to feel that, which is going to help your doctor understand that maybe you have a neuropathy, you have damage to your nerves. So that's why it is important to keep a foot exams. Okay, make sure you're getting a foot exams done yearly. Make sure you're getting your eyes checked yearly. Make sure that you are taking your medication. Make sure you are taking your medication as prescribed. So let me give you some tips. My tips include making sure that you take your medication as ordered, making sure that you keep your appointments with your doctor, making sure that you write down your questions that you have for your doctor, making sure that you know your body, and if you notice any change, you discuss it with your doctor, making sure that you are exercising, drinking water, eating healthy, okay, greens, healthy fruits. Make sure that you are taking care of yourself, because when you do these things, it is going to help decrease your complications when it comes to type 2 diabetes. All right, okay guys, that's all I have for you guys today. Always don't forget to leave your comments in the comment section. It helps me grow and it helps me know that you like this video. As always, stay safe, be blessed. Thank you for watching this video. Until next video, bye. Ciao.
That floats around me, keeping me safe and sound. And when I fall, you tied a rope to me. You're blessing me every day. I was down,